Hello, my name is Kay Aubrey Shemaine, and I'm the director of Photonic Therapy Institute, your host for this Independence from Pain Summit. My guest for this session is Paige Roberts. Paige is a brain performance specialist. She has her own personal connection to how light therapy can help overcome severe concussion and traumatic brain injury. And she's going to tell you about that. Paige has been a mind, body, sports, and life performance expansion specialist for over 15 years. She holds a BA in exercise science, a master's in social work, and is an integrative medicine doctoral candidate. Paige is a licensed independent clinical social worker, a certified light therapist, a certified brain health coach, and a certified brain spotting practitioner. She's going to tell us what that is. She has a private practice called On Point Performance Neurotraining, where she uses cutting-edge neurophysiologic therapeutic techniques such as brain spotting, photobiomodulation, and QEEG brain scans. These help to enable her to treat individuals suffering from various mental and physical health ailments. Her clientele range from CEOs to Olympic medalists. Paige's topic for this summit is light for a healthy brain. Welcome, Paige.
Hi, thanks for having me. So as Kay mentioned, I am a huge advocate for photobiomodulation light therapy. I have found some relief myself with it, so we'll go ahead and jump right into that. My personal story is, I fell off a slide at the age of 7 and had lost consciousness. The LOC is loss of consciousness. And with that, I started developing issues around gastrointestinal issues, and they diagnosed that at the time as irritable bowel syndrome. I also started to have sleep issues. And at that time, no one had really made the connection that it could have been potentially from that concussion. And we've come a way since then, particularly with Dr. Daniel Amen's work, whom he's a board certified both pediatric and adult psychiatrist, and he's one of the pioneers with doing the SPECT scans and looking at the brain and seeing what's going on with the brain, because I was having these symptoms, not being able to sleep, the gastrointestinal stuff, as well as just, emotional. I'm an emotional person in general, but I know that there was a shift about second grade when that occurred. And so now we know essentially that's post-concussion syndrome. But at the time, they really didn't know a lot about concussions and how that would impact you later on. And I'm 36 years old now, so that was 29 years ago. And then I sustained another accident. It was my swim team school bus accident. And we were heading to our first meet, and a deer ran out in front of the road. I was born and raised in northern Colorado up in the mountains, and so it was very icy, and the bus driver, corrected so we wouldn't hit the deer. We did a 360 and went off the other side. So this is a picture of that school bus, pretty horrific. It tore all the muscles in my shoulder, and then of course, concussion. And that one was very profound with the emotional results. Again, amplified, not being able to sleep, but also I completely remember that as a very distinct shift, right? Anything, I get frustrated if I couldn't get my seatbelt to click right away. Just every little thing, it was that quick to temper, our traditional, now we know in this field, post-concussion syndrome. And then I got into and around that time, I started dating a guy who used marijuana. And so at the time, I couldn't swim anymore because I torn all the muscles in my shoulder. And that was very devastating. And so I started hanging out with this guy who smoked weed. And wow, that helped me sleep. And Dr. Daniel Amen talks about you're getting the mouse stoned. So that part of your brain that gets overactive from trauma, particularly mental and physical combined, because that's what a concussion is. We call it a double whammy. You want to calm that area of the brain. And again, I didn't know really what I was doing with the self-medicating and what was going on. I just knew, hey, I could sleep. And that was a very positive addition to my life, yet it's not a healthy addition. So then I went on to college and continued to utilize marijuana, ran cross country in college and got a degree in exercise science, and was still marijuana was the crutch. It was to get me to sleep. And anytime I would go to someone and talk to them about it, they would provide like, well, it sounds like you have it all figured out, this not being able to sleep, it sounds like a manic aspect, but you don't have any other of the symptoms of mania. And so that would be bipolar disorder. And so it was always confusing. So I just kind of gave up hope with that. It's like, well, I'm good with utilizing this substance. And so then when I was 22, it's when I was working as an electrocardiograph technician and telemetry monitor at the Heart Center of the Rockies. And I was trying to work with professional hockey team and came home that night and hit a patch of ice, went through a fence and killed a cow. That cow lynched up my windshield to where the fence post hit me the side of my head, but didn't take my head off because the other fence post had taken off the passenger side headrest. And again, being in Colorado, this was the Front Range of Fort Collins, Colorado. You know, we have icy, strange conditions there with and around weather. So at that point in time, no longer did marijuana work, and I wanted to stop utilizing marijuana since it didn't work. So I went to a biological psychologist and he got me on Ambien. So again, miracle, yay, I can sleep. But again, never addressed the issue. And the issue being that I had endured mental and physical trauma, 3 of them, and that there was a physiological reason for these symptoms. And so that kind of is where I started with my understanding within and around, you know, that not always Western medicine, pill pharmacology addresses the problem. It just will try to treat the symptom. And so I went on to go back up to Steamboat Springs, Colorado, because around that time I'd started to decide that I didn't much want to work in cardiac rehab. And I had been more interested in the psychological aspect of recovery and was very taken with the social workers and the ER. And so I went back to a social worker in Steamboat Springs and started talking to him about what his work was and told him about my car accidents. And he said, well, you should try this type of therapy called brain spotting. I was like, okay. And so I did the brain spotting, and what brain spotting is it's a psychotherapeutic technique. And it's about 15 years old, but it's the combination of EMDR, somatic experience, focused mindfulness, and hypnotherapy. And all of these have been shown in peer-reviewed research to be effective on positively impacting an individual in releasing traumatic experiences. And so we did some work on the car accidents, and yet they helped me to the extent that I wasn't, when I was driving in a car, just completely terrified if I was on ice, holding my breath, thinking that we're going to wreck again. And so I was very taken with this therapy. But again, it did not address the inability to sleep. And so it was still utilizing Ambien, was convinced at that point in time from psychiatrists and other individuals that sleeping was far more important than what damage the Ambien could be doing to my body. As we know, it binds to the GABA receptors in our brain, so it's not always a great thing. And that's, again, Dr. Daniel Lehman's work saying, hey, there are other ways to heal. And again, the literature hadn't caught up by then. His first book was out, Change Your Life, Change Your Brain, or Change Your Brain, Change Your Life. At that time, but it hadn't again gone completely into what we understand about post-concussion syndrome now. So after that, again, stayed on medication and went to graduate school, became a social worker, became a brain spotter, started to pursue my clinical licenses. And I went to, because I was always this athlete, very physical individual, very interested in sports performance, psychology, and healing the brain and body of injuries, and was introduced to Dr. Robert Scar's work around that time. And so I have it listed in the presentation at the end of the PowerPoint, Dr. Robert Scar's books specifically. And he was an MD neurologist out of Colorado and had ran the traumatic brain injury clinic there, and had talked about how our brain and body doesn't really know how to respond differently to mental or physical traumas. So we kind of react the same way. So we go into this fight, flight, freeze, shocky kind of state, you know, and you kind of think of fetal position. We go down to this lower level of functioning, and you want to think of it as, particularly with the vagal nerve, our boss nerve within our system, it takes a hit because we go into this like lower level of functioning. I call it neurodepression. And so it can cut down the gut motility and all of those actions, reactions. So I was like, okay, so that explains the irritable bowel syndrome. That's fascinating. So getting into more of that and understanding and wanting to specialize in brain-body recovery from injuries. And then the emotional aspect too, because Robert Scar said that we respond to both the exact same way. We hold on to trauma the same way within our fascia and our tissues. And this is relevant because after I first started my practice about 6 years ago, I went to a sports medicine conference on concussions and suicide. And within that conference, I had learned about photobiomodulation light therapy. I thought, oh, this sounds like magic. I had worked in the athletic training room in undergrad, and we had been used to like, hey, if we have an injury, rest, ice, compress, elevate. You got 6 weeks out if you've broken a bone. Well, this photobiomodulation light therapy, 3 different presentations on products and devices said that you could heal a bone 50% quicker. I was like, okay, that's magic. You could reverse the damage from shin splints. You could address any other types of overuse injuries. You can knock down the chronic pain, cortisol that the body is producing as a response to trauma and pain. And again, cortisol is the oxidative stress. So that's tearing down our cells. So it's aging us. It's causing more inflammation, causing more pain. And so I was really taken with this, to say the least. And I bought my first hot laser, which had some E-stim aspects to it, and my first cold laser at the time. And in talking to one of the presenters, he was an athletic trainer out of Colorado, had worked for the Colorado Avalanche for 20 years. And he started to say, oh, you work with a lot of skiers and snowboarders, because being out of Steamboat Springs, Colorado. And I said, yeah. And he's like, well, you need to look at Dr. Michael Homblin's work on post-concussion syndrome and all of those pieces with healing the brain and what positive impact light therapy can have on any neurocognitive disorder. And so that's what got me into what we're talking about today, beyond my own story of how it impacted me and how I got to where I am. And I guess, to spoiler alert here, I started using photobiomodulation on myself, and I was able to come off of the Ambien and sleep. And I sleep amazing. And I'm pretty addicted to the light therapy itself, but it is only a positive attribute to every aspect of my brain and body. So I'm okay with saying I'm addicted to photobiomodulation as opposed to a pharmaceutical, so that I can sleep and get good sleep. I don't wake up. I sleep 8 to 9 hours. At this point in time, it's humorous to think that I'd sleep about 5 or 6 hours on Ambien and think I was good to go. And again, research is telling us anything less than 6 hours is causing neuroinflammation, causing this cortisol tearing down process within the brain and the body. But yeah, so that was my experience once I got these miracle lasers. But when I started looking at the literature and what light therapy can do for concussions, I was completely blown away. And so that gets us into what is a neurocognitive disorder. And it's really a fancy name for basically saying that there's a decrease in blood flow in the brain and that we are starting to lose some of our cognitive processes, how fast we're thinking, how we're able to recall information, how quickly we're able to recall information, how fast we're talking, our focus, the capacity to sleep. Because actually brain damage begins to cause this type of night timers syndrome, where people can't sleep at night and then they're kind of foggy and tired all day. So it all connects here. And this is just the very specific definition from the Diagnostic and Statistical Manual on Mental Disorders. And so this is my Bible when it comes to the work when I'm assessing an individual when they come in, to see how far we can bring them to optimal health. That's how I frame it. Not how bad you are, but going, hey, how much room we have to heal. So that's what this neurocognitive, if no one had ever heard what that means. And the common types here, not going to necessarily go into them because you guys have access to these PowerPoint slides. Again, decreased blood flow can happen from environmental toxins, can happen from even pharmaceuticals. You know, we hear about all these terrifying adverse effects that pharmaceuticals can have on an individual, and some of them are causing inflammation in the brain and brain damage potentially. And then just talking about the normal process of aging. We start to lose cells. When we talk about the benefits of the photobiomodulation to the brain and losing cells, we think of it as a cell in our body has 4 oxygen molecules. Cortisol stress or any other stressor in our environment takes away one of those oxygen molecules. That's called a free radical. And so we only have 3 left. Well, the cell can live if we get an antioxidant in there, which we produce when we apply the light therapy to the body and the brain. We produce nitric oxide, which is an antioxidant, so it can save that cell so it doesn't die. But if we lose 2 of those oxygen molecules, the cell will die. So we don't want to lose cells. The idea is that we want to keep as many cells as we possibly can, because that is preventing aging, that is preventing death, that's preventing any of these types of degenerative disorders. And it's not just positively impacting the brain. As I've talked about the brain with cells, I'm also talking about every single organ system within the body, because they're all working together. We know that there's a higher instance of neurocognitive disorders and Alzheimer's and dementia, and primarily the temporal frontal dementia when we have a decrease in blood flow from the heart beginning to not work as efficiently. So when we're putting the light therapy on us, we are assisting our entire body in decreasing how quickly they're losing cells. So I thought it was profound when I learned in undergrad what an antioxidant free radical was, because no one ever really tells you what that means. It's like this buzzword out there. Yeah. So again, going into the Alzheimer's, and I can leave this for all these individuals to talk about these things. But the biggest thing that I see is individuals starting to become depressed, apathetic, not wanting to participate with things, forgetting, obviously, forgetfulness. That's the primary thing here, to where it can be dangerous to an individual to live alone. So then they have to move into assisted living facilities, which is a lot of grief and trauma within and of itself to lose our independence. So I start to see that kind of, social, psychological reaction when I see an individual in my clinic. So it's what makes me the saddest about it too, is not just that they, forgot who their best friend was in high school, that they're losing their independence and they are failing to thrive. And so that's one of the pieces with Alzheimer's that I see that's more common than anything else. Well, the bigger complaint, shall we say. And then additionally with frontal temporal dementia, and at this point in time, we see these things on SPECT scans and the QEEG brain scans, which would put this funny little hat on our head and measure our brain health. So we start to see atrophy in the brain. We start to see the decreased blood flow in the frontal lobe and temporal. And when we talk about the frontal lobe, that's all of our attention and focus. So when an individual who's had a concussion or is starting to decline with the blood flow in the brain, I'm trying to call it more of that, because it's, when we diagnose it as this like permanent thing, that's just not the reality of things. It's a decrease in blood flow. We can bring that back. Tissue can function again once it has a healthy blood supply that's bringing the nutrients to the tissue in the brain. Nonetheless, again, you start to see that on these scans up to 10 years prior to actually having some of these psychological or noticed symptoms. So that was my point with that, is that if you are concerned about dementia or Alzheimer's or any of these other neurocognitive disorders, including Parkinson's, Lewy body, all those other ones on the list, it would serve you to go get a QEEG brain scan. Literally Googling QEEG brain scan, you will pop up a whole bunch in your area and who is trained to do these scans, or the SPECT scan. Again, that's Dr. Danielle Amen's work. And there's another company out there too that takes insurance, so that's positive. So there are ways to assess this prior to getting the psychological, social, observed symptoms to see where you're at. However, are starting, if you're starting to see some of these symptoms, your family's observing them, or you are personally recognizing them, get a light therapy device, find a light therapist in your area, and let's just address the problem. And sometimes, you know, it's people come in, they're like, do I need a brain scan before I can start treatment? It's like, no, if you want to invest your money into treatment, we will do that, as opposed to spending the money on the brain scan. It's beautiful in science to always have a pre and a post, and I've had many of those, but I've had many that we have just monitored symptoms, the observation, and then the subjective. So next, of course, we all hear about stroke, scary, and we all hear about the issues that lead to stroke, including right at this moment, COVID. Scary. People are talking about that can be a result. And COVID is an inflammatory, our body's reaction to the virus because we've never been exposed to it. And so speaking around those types of things, it's like, hey, we can actually address some of these issues, shall we say, on this list to prevent the stroke, but we can also bring back blood flow to the brain after the stroke. But really looking at these as, you know, obesity, we know with the photobiomodulation, we know that about an hour sessions of the light therapy, polychromatic pads specifically, they're one of my favorites at this point in time, we can actually start to break down those toxins and break down the fat and lose weight. That's amazing because fat's really tightly you know, interwoven with toxicity and toxins. And so Dr. Danielle Min talks about that, about how toxic our system is and how obesity and holding extra adipose tissue can negatively impact our brain health. And so I thought that was very fascinating. He actually calls it the dinosaur syndrome. And I don't know, it sounds kind of mean, like the small head and the big body, small brain. Yeah, but he's very set on his trying to shock people into being motivated to change because he hates to watch people get sick, wants people to be healthy. And I truly feel the same way. So then when we look at other things like, again, the traumatic brain injury, untreated depression, I talk about depression being neurodepression. Because when we do go through trauma, mental or physical, we go into this kind of depressed, like guarded state, and it makes us very, you know, less likely to be as extroverted and going out there and trying new things. And we know that experiencing and trying new things and social engagement actually keeps the brain healthy. So thinking, because it increases the neuroactivity, blood flow, neuroactivity. So again, applying the photobiomodulation to the brain after, you know, when you're feeling depressed can actually bring back more blood flow and neuro energy in the brain. And I've seen that over and over again. And there are actually peer-reviewed studies that have shown this very specifically, that it decreases people's depression. And that's clinically. And so that's what I'm here today saying. What I've seen clinically, there are 5,000 peer-reviewed studies how photobiomodulation positively impacts the body. But what I've seen clinically is just so rewarding and exciting because you can read about these things, but then if you're not seeing it in front of you and seeing your clients shift and change, you just really don't know. So there we go. Oh, and of course, high cholesterol, again, kind of detoxing the liver. And again, if we decrease our depression, decrease the holding the extra adipose tissue, bringing back blood flow to the brain, we can go out and do more exercise. So yay, okay. Traumatic brain injury concussion. So this is what I suffered with 3 times. I'm lucky. But most athletes, you know, when I'm working with a teen athlete, I will see that they've had about 2 or 3 by the time that they are in high school. And it's really doesn't even necessarily have to be their specific sport that they're participating in that point in time. You know, it could be a bike wreck, it could be a ski crash, it could be a snowboard crash. And I know a few times I caught my edge snowboarding that I'm pretty sure I had a concussion, but it wasn't diagnosed. And it, yeah. So who's to say I didn't have numerous others?
Exactly.
I was a, you know, kind of outdoor tomboyish kind of girl out there jumping around, playing around, rolling around. So who knows?
Yep, mine was horses. Came off many of them long before we had helmets.
Well, yeah. And that's, when we're talking about velocity and so on, that's the fall, the contra tube, the brain bouncing around in this hole, and the speed at which you were going. And so we're going to, you know, that's a little more severe brain bruise is essentially what it is, a brain bruise that is causing inflammation. And that's what's kind of, you know, when you look at and think about a brain bruise, because that's what it is, and you just can't see it, but it's there, you have these symptoms. And it's funny because even in my office, you know, I'll have the clients come in and say they got a lacrosse ball to the arm, and they'll have this big knot, and we'll put the light therapy on it, and it will kind of, you know, disperse it, but it turns it a little more yellow, you know, and so it speeds up the recovery of it. So that's really what's going on with the brain. So
Well, the brains, let's say the brain bruises in a concussion. Can it build a hematoma, like a dried blood clot, just like we get on our bodies?
Yes. And so, and that's what can be scary. So when we're applying the photobiomodulation to the brain, one of the more concerns, shall we say, with it is that it increases the blood flow. So it can actually cause a brain bleed or a blood clot of that nature. So the standard within and around saying the concussion parameter here is after a week, it is no longer a concussion if you still have symptoms. It is then considered to be post-concussion syndrome. And then we take another measure at about 3 weeks. Do they still have a concussion? Then we take about another 6 months, then a year. 80% of individuals are healed after a year and even sooner potentially, right? So we know if someone's still having symptoms, post-concussion symptoms after a year, that they had going into the head injury, a decrease in brain reserve is what we call it. So perhaps their lifestyle was not one that was very healthy, so it's allowing more neuroinflammation. Because again, neuroinflammation is the issue. We're always trying to decrease inflammation. That's that cortisol stress. And when we talk about cortisol stress, so trying to explain it further, we've got our brain here. We have within our brain, it's a pea-sized organ called the amygdala. And so based off of past experiences in our current feedback loop from our 5 senses, we are going to, touch being one of them, so pain, ow, touch, boom, ow, we are either going to produce oxytocin, positive experience, or cortisol, bad experience. So cortisol is pain, cortisol is inflammation, so we are always trying to decrease cortisol. And so that's when people are like, oh, oxidative stress, that's causing this, oh, blah, blah, but people don't really know what that exactly actually means. And so when we talk about the photobiomodulation, it combats oxidative stress cortisol. Oh my gosh, that's amazing. So let's decrease your overall stress. So let's decrease the neuroinflammation. Let's decrease your pain signal. Let's increase your brain reserve so that you're healthier. So if you did get into a car accident, you're going to be able to heal within the normal parameters. Really cool stuff. But when we talk about that week though, that's the concern that if we had a brain bleed, that if we had a blood clot forming or those things, we don't want to increase the blood flow because we could have more excess bleeding in the brain. So when people contact me, oh my gosh, my kid went down in a soccer game, this is this. There have been times when I've been like, well, we could do the brain stim, but I will not put it on the entire head. And even then I would be apprehensive. I'd be like, well, how about you bring them in next week? Let's see how they're doing. And then we start with the brain spotting, where we talk about the traumatic experience and get their brain and body to relax and to calm down from that experience. And then we throw the photobiomodulation on there to go ahead and start increasing the blood flow, decreasing the neuroinflammation to get them on the road to recovery quicker.
Interesting.
Yeah, that's, and again, I can't tell you how many times, I wish I could even count over the years of how many times people have been like, well, my sleep. And I just sit there and like, huh, yep, that's this. Well, my doctor didn't say that. He thought it was this. I'm like, nope, that's concussion. And it's just so funny because it is absolutely, yes, the psychological experience. But if you have that neuroinflammation and every time you lay down and your brain's going, oh no, oh no, oh no, oh no, we can't lay down, we can't relax. We got to be with it. We can't let our head get hurt again. We can't go to sleep because then we could potentially die. I mean, it's that severe of an unconscious reaction in our brain and our body. And currently right now, it's coming out next February at this very favorite conference of mine through the University of Pittsburgh Medical Center and Ann Arbor area, the Human Performance Lab. So we're talking about 2 different mavericks in the concussion world. Dr. Mickey Collins, he was featured in the movie Concussion. Alec Baldwin played him. works with the Steelers and the Penguins. Yep. And then we've got Jeffrey Kuchar in the Ann Arbor area. And then he's got a little satellite clinic now in Utah where the US ski team is, because he's working with them. But they actually have a sleep lab for post-concussion syndrome. So we're going to see what's going on with all of that. So the literature is finally compiling to show us like, hey, this is an issue. And again, all of these things that I have talking about these disorders on my PowerPoint are from Dr. Daniel Amen's work, because he sees that it is the lack of blood flow, lack of circulation, lack of nutrients getting to the brain. That's why we're having these issues.
Right.
Is consistent with the photobiomodulation, and that is why I'm a certified brain health coach through his curriculum, because it all is this cutting edge, newer way of looking at things. It's not just this wait and see model, and it's utilizing our resources to assist someone in healing quicker, because it's truly, our lives are short, and to struggle and hurt and to suffer, man, we don't have time for that. We've got science. So that's kind of where I'm at with this stuff. Also here in the Pacific Northwest at the Bellevue Clinic, we are starting to do more concussion research and trying to bring in the light therapy and bring in the brain spotting. They've already done a study in Atlanta on the brain spotting and how it positively impacts the brain's blood flow. But then the, adding in the light therapy, that's like the double wow. And that's Dr. Chapek. And so he wrote this book, The Concussion Recovery, or Concussion Rescue, Recovery, Rescue. Nonetheless, just really more of this integrative model, we want to be eating healthy, we want to be exercising, we want to be getting enough sleep, we want to be using the photobiomodulation that's available to us, we want to be using psychotherapy, we want to be engaging socially with people, we want to be doing brain training games, all of these positive things to reverse aging and to increase our cognitive performance. And to me, this stuff, I nerd out on this stuff, obviously. I just love it because it is just so exciting, and to see that someone doesn't have to be the way that they are in that moment and suffering in the way they are, that things can change. And that's kind of with Dr. Daniel Amen's new book, The End of Mental Illness here. And then we go to another MD, and he actually talks about photobiomodulation and the brain's way of healing. And so that's Dr. Norman Deutsch. And he also uses brain spotting in his practice. So the trauma reprocessing therapy with the photobiomodulation. So this came out a couple of years ago. And so I will have people Google photobiomodulation and concussion recovery after they've read this book and find me. And so I think it's just amazing. It's so fabulous to see these maverick cutting edge doctors showing people that there are resources, that they don't have to just get, the pharmaceutical from the Western doctor and say, okay, well, if that doesn't work, I don't know how to help you, bye. Right. And I'll tell you how many times I've heard that story, and guess what? I heard that story for how many years?
Sure.
Empowering and discounting. Feel like something's wrong with you. Okay. So I talk about the polychromatic pads. And so I said my first lasers were these. And these lasers, you had to be a licensed clinician to have. And so we actually petitioned the company and allowed for me to use my social work license because I was treating neurocognitive disorders with it. So I was very positive, and I said that there was research at Harvard with Dr. Michael Hoblin, whom you will hear from within this series, who's the, 93 is when he started with the light therapy at Harvard. Amazing for addressing these neurocognitive disorders. But nonetheless, after about a year and a half of having these and seeing phenomenal, profound results, and one of them I actually got to have written up in this healing with red light therapy, most recently. This was just published. And I talked about an athlete whom came in whom had a concussion, but also had a back injury in her lumbar spine to where she couldn't even sit down. She was in such chronic pain. We're talking a junior in high school here. Devastating to say that this individual would never get to ski again. The orthos were saying, hey, let's fuse the spine. Horrific. She was doing everything, doing the core exercises they suggest with physical therapy. She was doing foam rolling, and they came to me just like, we don't know what else to do. Dad was a past US ski team coach. Brother's actually an Olympian. He's a ski jumper. So to this person would never get to ski again with her family, never get to participate in sports again, or even exercise was a complete horrific, you know, I guess, results here. And of course I understood, because here I am, this athlete, I love to exercise every day. I couldn't live without exercising, and had my own chronic pain. And so that's why I love this light therapy, because it positively impacted me right out of the get-go when I met the athletic trainer, and he's worked on my neck and back and some of my overuse injuries from running. So I said, I don't know, let's just try this. And so we did about 5 brain spotting and light therapy sessions combined, and then did about another 10 more light therapy sessions, because we'll talk a little bit about parameters here. But one day the individual, I said, well, maybe go to the chiropractor again, because you could literally see the disc off to the side. Chiropractor, cracked back in, fine, perfect. Able to ski again, play soccer again. I mean, positive, wonderful story. I cannot imagine if they'd fused her spine and what all of that had meant at that moment in time. So that was one of my most just like, okay, this is what it is. But around the same time, and why I say that, because the family bought a set of these polychromatic pads immediately when they became available, from this other practitioner in town, Sally Dyer, who said, there's this new device, they're these polychromatic pads. And so you have more diodes, you have more of these little lights that positively impact the body. I'm going, wait a second, I have like, you know, if you look at this, how many little diodes in there? And then you're looking at these pictures, there's hundreds. I'm like, okay, this is amazing. And she told me that they were actually doing a study with veterans who had sustained traumatic brain injuries, and that it was after that year marker where they say that most people should heal, and if they don't, they're going to be that way forever, they say, which is not true. And what I've seen totally opposite of that. But nonetheless, she said these polychromatic pads. I said, okay. So I was interested. And at that point in time, then I wanted a set of these pads, and I want to start playing with these. And this was the one I put on these pads every night before I go to bed, 20-minute interval, and I'm falling asleep halfway through the end of the session. Love, love, love them. Started utilizing these. You could cover more surface area. And around the same time, they were talking, Homblin was talking about what the magic essentially dose was here. Because the big debate in the very beginning with the light therapy was, what was the dose? And it was really funny because I did a training with James Carroll. He's who brought light therapy to Harvard in '93, a couple years ago. And someone asked him, like, why on the big laser is it a 5-minute interval? He's like, because we didn't know anything then. It just 30 seconds on the spine. And I'm just like, oh my gosh, this is so awesome to hear this evolution of science and people who are not stuck in this old, because the second someone's telling you that something's going to be the same way forever, don't listen to them. That's just not true. Once something's published in hard science, it is irrelevant, that there's already something evolving. And I learned that within, you know, the hard sciences of exercise science. And then coming over to psychotherapy, where brain spotting is 15 years old, and we get resistance from therapists going, well, why is it not cognitive behavior therapy? I'm like, well, because that's 40 years old. Like, we want to do something that's a little more evolving. So it's really interesting, because again, neurocognitive disorders are kind of considered over here in psychotherapy, but then there's the sports medicine model where, like, hey, we're doing this, 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 and these people are recovering and healing. So it's interesting. And I'm telling you right now that to sit here and think that you cannot heal and that there won't be some evolution within science, such as these light therapy devices, is absolutely inaccurate. So excited, got these devices, heard about the study going on, and this is not a client. I had these photos done to just showing what these processes look like for my business. So this is not violating HIPAA, and someone doesn't know they're getting their really horrific photos taken, because you don't look very cool wearing this stuff. But like I said, the lights are out upstairs on the bed, no one's seeing anything, so it's all good. Actually, he liked it because, you know, he got some fun light therapy. He thought it was amazing. But yeah, so this is what it looks like in my office, just completely, I guess, high tech. At this point in time, they are coming out with photobiomodulation beds. So you just strip them and hop in there, and there's some, you know, gosh, actors and professional athletes who can afford one of these. They cost about what a house does. They're quite amazing. But with that, so when we talk about these light therapy devices, okay, so you're going to hop online and Google some stuff. Well, 70%, and this was from James Carroll's training, I absolutely believe him. He is connected with Harvard and some of the most, you know, profound, like, you know, the bottom foundational research here. They don't do what they say that they do. So they got the FDA approval to have the little light therapy diodes, And so they're saying it does with these other ones who have been calibrated by physicists, who have been tested in peer-reviewed literature, so they can say that they're doing those same things. But we don't necessarily know if they are. So you must know if they have been FDA approved as a medical device or a device saying that it does what they say they do. And one of the hardest things for me is when a client's like, well, yeah, they have this one. It's like, you know, $100, this is this. I'm going, email the company if you can get the physicist report that says, hey, these do exactly that. They admit this exact frequency. They're doing exactly what they say they do, and that there's a peer-reviewed research study, and that their FDA approval is saying it does this thing. Well, these polychromatic ones literally say increases blood flow and circulation. So what does that do? That decreases the neuroinflammation. It decreases the pain cycle. It stimulates the mitochondria to produce nitric oxide. So again, that's combating that damage, that oxidative stress. And then there's been some literature lately talking about nitric oxide and being an antiviral. So as
Right.
decreasing inflammation and it's an antiviral. Well, second that COVID came around, I doubled up on my light therapy because I'm going, hey, you know, I don't want to get sick. I wouldn't be and that would be really tragic to me. And who's to say that I wouldn't go into a cytokine storm? We just really don't know. So decreasing inflammation has been very important to me with all this going on. And I would hope that it's important to everyone else because it's scary. Okay. So polychromatic pads. And so just specifically talked about that study, and here it is. And it has the DOI on here. So when you have your the handouts, and I can even download this study if it's not being downloaded by another provider within this you know, online summit. This is the very specific study that talks about the in-home polychromatic devices and how they positively impacted all of these veterans. So this was quite amazing. I've had personally been able to meet Dr. Hipskin and amazing PhD, MD, and he was just so excited about this light therapy way back when. So, and again, measured by SPECT scan. So that's the Daniel Amen's work in talking about the blood flow and the patterns in the brain. So we knew it increased blood flow. They also talk about hyperbaric chamber. So when we talk about the dosing, hypersaturating our body with oxygen, we only get more positive results from that therapy if we're utilizing the photobiomodulation. And that's the same kinds of principles of you're going to get more gains, less muscle soreness if you do the light therapy concurrently with working out. So you're just providing this positive environment within your systems and your body to take in more oxygen. Yeah, and it's one of Hamblин's study most recently, working with athletes, you're going, hey, 300% more gains is what they said in one of the studies around using the photobiomodulation with, you know, training. So
They've done that with horses for decades. That's where a lot of it started. Yeah, they could measure that increased oxygenation, that increased muscle ability.
And the funny thing is so my Basset Hound Dachshund, the second I put in the light therapy, she comes off her bed that sits on my corner because she's my soulmate, and she comes over and lays next to me and wants her pad on her back.
Of course.
And it is pretty funny because, you know, animals, you know, she doesn't know, she just knows she feels good. And within seconds, she's just passed out with it on her because it's calming her down, it's decreasing her cortisol stress, and it's pretty humorous. I can't sneak the light therapy on. She'll be dead asleep on her mat and then come over when that light therapy comes out. It's so funny.
Very common.
Yes. Okay, so the case studies when talking about healing and individuals healing, you know, when we talk about an automobile accident, because we were talking about the horse TBIs, whatever you want to call it with that. Gosh, it's a sports injury. It's all sorts of things. We're talking about a lot of joules, a lot of velocity. So
right.
That's a pretty severe bang, bang, bang of that contracus, secondary concussion of the brain bouncing around the skull. And so it takes about 15 to 20 sessions. And if an individual can have access to doing it daily, I prefer daily. You know, I tell people, because if they say, hey, I can only afford this weekly or can only come in bi-weekly, I'm like, that's fine. You're not going to not make gains or lose those gains. You know, this isn't like exercise in the sense that it's like, if you only work out once every 2 weeks, you're going to backslide. Absolutely not. You're going to maintain those gains. So if people can't afford, you know, that's what we have to do. That's great. That's fine. But daily would be amazing, and you heal even quicker. but typically I do about 15 to 20 weeks with people when it comes into coming in for the automobile accident.
Sure.
Just unwinding some of the traumatic experience itself, because we actually produce a chemical that makes us not remember when we have severe trauma. So when you're working with someone in the trauma reprocessing therapy, and then concurrently bringing back the blood flow and decreasing the inflammation, the story is unwinding more and more and more. I'll have an individual sit in front of me and tell me about what happened, and they'll just be bits and pieces. I really don't know. I have no idea what happened. And they think they told me this thorough explanation. And so about, the 10th session, they're going, oh my gosh, yeah. And then we slammed on the brakes, and then I remember this, and I remember this, and they're remembering all the pieces.
Wow.
I truly love the combined process. You don't have to do the combined process. Obviously, as I said, you are going to get these physiological gains. You get some of the depression decreasing, and then also more with the gut stuff. So I talked about, so going into the sports concussion piece, it is very common, again, to hear individuals, teens, say, hey, oh, and then I started having gut stuff. I started having irritable bowel. I've had this going on. And so when we're putting the light therapy on the skin, and there's peer-reviewed literature to show this, we are actually positively impacting our gut microbiome. And so that's all the bacteria, because all of our microbes communicate. So sinuses, lungs, skin, gut. And so it's actually positively impacting that as well, just by having it on our skin. And when we increase our microbes, that can assist with our gut motility and decrease the susceptibility and even kind of heal the leaky gut. And so that's another big buzzword that people are talking about. Oh, I have leaky gut. It's like, okay, well, what that means is the microbes get wiped out from chemicals or something, or because just so you know, glyphosate, the stuff that's sprayed on all of the Monsanto stuff, wipes out our microbiome. It's like we're just like sucking down diesel fuel to wipe
evil stuff. Yeah, evil.
Horrible. But what happens then, because our muscle in our small intestines is very fragile. It's very slick. It's very thin. So many people get diverticulitis. That's where it starts to tear. It's just really horrible. But the thing with that is if it doesn't have that microbes, when we're eating, that's really aggressive on our gut. And so it starts to tear, make little microscopic tears and gets less strong, essentially. And so then the contents of our stomach starts to leak out into our bloodstream and goes and causes inflammation in all of our organs, just not the brain. But you hear all this stuff going, oh, I have leaky gut syndrome, so that's why I have this chronic fatigue going on, or I have this chronic neuroinflammation, and my immune system's low. Well, that's what's going on. But what I've found is that when you put the light therapy very directly on the gut, it's helping that smooth muscle also. Because again, if it's muscle cells, we're increasing their capacity to survive because the nitric oxide's going on there and keeping that muscle cell. So thinking about it, all the systemic, physiological, positively impacting expansion type of modality, increasing gains when you're working out, a chiropractor, all that kind of stuff. People say, oh, I go in, I just can't get this rib back in. Like I said with the youth athlete that came in, we finally got enough of that inflammation down that the chiropractor adjustment took, and the body was relaxed. It's like, yes, here it worked. And so it's very much a complementary modality to massage, acupuncture,
right,
chiropractor, all of those things. And as I know, Kay's discussed with the meridians. Okay, so it's positively impacting all those meridians, it's stimulating them, just the same as like acupuncture. So when you have all these pads all up and down your body, you're thinking that that's not positively impacting all those meridians and increasing your neurocommunication and efficiency within the brain and body, which is also increasing the circulation. We are reversing aging and feeling amazing. So that's the other kind of piece with the sports concussion when we're talking about the leaky gut and the gut motility, getting those muscles to work again. And again, it's possibly impacting our vagal tone, so our boss nerve. We know that within 24 hours of enduring physical trauma, for sure, we know that from Dr. David Musnick. He is a triple board certified MD doc here, has been featured on Dr. Mark Hyman's The Broken Brain docuseries. And he has found that within a day, that gut motility slows down. It's all locked up. And so you start to get this imbalance in microbiome and starts to get the leaky gut and then causes more problems. So it's, again, at like a week, I get people in here, let's start applying this stuff. Let's get going. Let's get you healing. And then just, you know, anecdotally too, and it's fairly common though, you know, about the 5th session, I will have a teen athlete, about 17, tell me that, you know, they had a concussion. The first one was at like 14, that they are no longer feeling suicidal or having this impending doom sensation. And you just sit there and go, yeah, that's post-concussion syndrome. That's what we're talking about here. You know, that's what we're talking about. Dr. Mickey Collins found with, again, the guy at University of Pittsburgh who worked with all of the TBI, the first stuff coming out with all these retired players. And they're going, hey, CTE, killing yourself, all these things. Dr. Danielle Amen, Dr. Mickey Collins has found that if you do the proper, you know, interventions, a person will heal. But it takes work. You know, it's like, it's not just one thing, because it took years to get ourselves into these situations. It took years of naughty behavior when it came to eating not great things, staying up late, drinking and smoking and doing all these things. Like myself, it was wanting to get off the marijuana, then the Ambien. And I know that that probably wasn't great for the GABA in my brain.
So Paige, I'm looking at your case studies here. I see that obviously there's an age progression. The older the person, the more sessions. And then you're all the way up to like 50 sessions for Alzheimer's. Can you talk about that?
Well, with Alzheimer's, again, once we start to have the noticed symptoms, we have a lot of decreased blood flow to areas of the brain. So it's just going to take time. You want to think of it as breaking down layer by layer by layer, bringing back the health of the brain. And
well, that makes sense. That makes total sense.
50 sessions, well, gosh, there's 356 days in the year. So is that much, you know, like, but really maintenance too. So thinking about, okay, so I'm susceptible already because of my 3 concussions. I'm susceptible already because I have a lot of food intolerances. I'm susceptible, you know, there's all these risk factors within me. So then my genes say that I'm more susceptible to autism, Asperger when it comes to neuroinflammation and some of those things. And again, doing methylation analysis, there's people in your area that can do that. But nonetheless, just knowing that, hey, I'm at a higher risk. So I don't drink, I don't do drugs, I don't do any of these things. I try to really watch what I eat. I have food intolerances to the inflaming foods, very specifically. Just had another allergy test on of wheat and dairy. And that's what Dr. Danielle Amen talks about, is being very inflaming. Like, oh man, those are the ones that are off the chart for me. All nuts. It's like, oh, I'm a vegan, so it's difficult. I have to pair amino acids to get enough protein. So, you know, it's maintenance too. And if I had my way, people would have one of these light therapy devices or some configuration, like you said, with the acupuncture points, of having some type of LED laser or something to be able to enhance the meridian energy, to increase the neuroactivity, to increase the circulation, because you can't have neuroactivity and circulation. You have both no matter what. They go together. Right. So thinking of it that way when we think about the electrical system of the body. Stroke, I've had some profound results with that. Like, it's just, everyone's different. You know, I am not one that's going to say, hey, it's just this. You know, I like 10 to 20 sessions because that's what our literature is telling us with all of the light therapy, and all of our manuals have told us that, and all of the literature that came out with these big lasers. This is basically the type that the National Hockey League uses, you know, and very similar type that the National Football League uses here. So they're saying 10 sessions. If you should start to see a shift at 10 sessions, but one session, you could get results. But we don't want to say like, oh, because again, it's that kind of breakdown, rebuild process. We are constantly tearing down and rebuilding. And at age 25, we start tearing down more than we're rebuilding in all of our tissues. So thinking about that way, yeah, so you get a teenager in here, 5 sessions, oh, they're golden, they're out the door, that's great. But when you're talking about someone who's a little older and is not rebuilding as quickly, it's going to take more time. And so
yeah, that makes sense.
And another thing I wanted to talk about with people have probably heard of vision therapy with concussion treatment. It's huge right now. Our brain is 80% visual. This is all our, neuroocular occipital part of our brain. I have had clinically individuals make gains quicker when they're doing the vision therapy, which is essentially the neuroocular little muscular gains, same as strength gains. From the vision therapy, they want to, have their sessions with me right after that because they make more gains, they recover quicker. So it's the same as if you were strength training. You're not going to be as sore as long. You're not going to have, because there's typically a recurrence of some of the post-concussion syndrome symptoms when you're doing vision therapy. And I had that happen myself. Another personal story is when I went to one of these concussion conferences, Stanford came out with this device called iSync, and it's like little binoculars, and you draw a circle with your eye, and you're using your smooth pursuit. And they say 80% of the time with a concussion, the smooth pursuit is messed up. Well, I was 29 years old. The last concussion was at 22. They literally looked at me and said, "This is horrible. Did you just have a concussion?" I said, "No, it was years ago." And they're just like, they were horrified. And then, wow. You know, I had my brain scanned at the same time. Well, I had a good voltage, is 18.5, which top would be about 20 volts. Again, talk about all of the energy, neuroinflammation going on in our brain, as much as to light a light bulbs going on in our brain every day. My voltage was good, but there was still something else off. Well, when I started doing the vision therapy, because I was like, oh my gosh, I can be more cognitively clear. I can focus better. My eyes won't get blurry as much. When I would have the residual concussion symptoms come back up, the blurry vision and stuff, I would put on my light therapy and was able to heal myself with that. I mean, this was, wow. You know, I couldn't believe it. And mind you, I had that done, but there weren't any vision therapists at the time. So I had to wait until that evolution came, because they're going, well, there's these one devices that, I mean, that was Stanford, for crying out loud, you know, so they were really piloting some of that stuff then. So it's almost like you go to these conferences and you think, oh, this is really cool. Well, it's still in research studies. We're like, oh,
yes, I've gotten a lot of that.
Yeah, so that's what's great right now about the photobiomodulation. So thinking that things just auto-correct is not always, we just get used to the way that we are.
Right.
I know
we find a new normal. It's not a healthy normal, but we just learn to deal with it.
Yep. And so I'm saying that we don't always have to learn to deal with our cognitive movements. Yay. Okay. But yeah. Oh, stroke. Yeah. So I had this woman. It was awesome. Came in. We had 7 sessions, and each time, you know, just more and more clear, understanding what was going on. And then finally kind of the anger. I see kind of when the brain's waking up, people are angry that they had been that way, and that they hadn't been as productive, that they had been this person before, then that happened. And it was just really funny, because just completely, and again, then reframing it though, you can't be mad at yourself. You were a victim. This was some trauma. This is what happened. But it does kind of crack me up. When the brain wakes up, we wake up that tiger and we get pretty angry, and we have to extinguish that and work through that to that positive space and functioning. And yeah, so I've seen that more so with stroke. But if you think about it, stroke is not as long building. It is more with the concussion area of it just happened suddenly. So there's going to be some more grief and trauma with that. But
right.
Nonetheless, fabulous results with things. I can't say enough how much, if you can't afford one of these things, going in and seeing someone, you can come in weekly, bi-weekly, whatever you can afford, you're going to see results. But ideally, yeah, let's all have, you know, let's save up our money for a year to have something like this for our whole family to use. So now this guy here is our, let's bring up our little guys here to be able to look at these things. So when I'm talking about the QEEG. So this is really, we're narrowing down here, guys. I know it's been giving you a lot of information, talking really fast. It's so fast I talk, and I forget who I'm talking to a lot, because I'm so deep into this stuff that this stuff is just like everyday knowledge and normal to me. So I apologize if I've ran through this too quickly, but nonetheless, QEEG results. Again, this guy, we put little electrodes in here, put on this cap. We do little things on a laptop showing us how quickly we are auditorily reacting, physically reacting. That's this trail making A and B up here. Then again, the auditories, this P300. So I'm hearing a ding and how quickly I'm clicking the mouse. And then we've got some other metrics here talking about the difference between beta being really anxious and upset, and theta being calm, cool, collected, relaxed, and ready to take on the world. And so we don't want a big difference between the two of these. So that's what's going on here. And with this individual, we did 20 light therapy sessions, a 78-year-old woman. Kind of an interesting story here. She had went to the Amen clinic years ago and had her brain tested and assessed and was really interested in all the brain health stuff. She's a really progressive woman. She was a nurse back in her day. And so she was already fairly aware of some of this stuff and had sleep issues. And they hadn't really addressed them at the Amen Clinic at the time, which I thought was interesting. And then she read The Brain's Way of Healing. And then I had attended a functional medicine group with that Dr. David Musnick, and he does online telemedicine consultations if people want to know more and be further assessed by him, because he's quite good. Nonetheless, I went to this training and I ran into a naturopath who was down 2 hours south of where I was, and that's where this individual lived. And she was talking to Dr. Musnick, and I came up and started talking and said, well, it sounds like, you know, she does QEEGs and she can show this, this, this. And she went, oh, you do QEEGs? I said, yes. And I do photobiomodulation, some of the stuff, and got to talking. And it was funny because then she went back to her office and saw this individual. She told this individual, gave her my card, because I gave her my card. This individual saw online that I do photobiomodulation. She'd read about it in this book. And the reason this person was seeing her was she'd been working in her garden, and one of her friends hit her with the butt of an axe in her temple. And it sounds horrific, and it just was what it was. They were out there, and she was too close to her, and yeah, so she had a concussion from that. So very scary. So this individual traveled all the way up here, had all of her Amen spec scan stuff, which was pretty irrelevant at that point in time, because here we are about 10 years later, and she sustained an inflaming action to the head. And one of her biggest issues was, I can't sleep. Amen couldn't figure it out. I've taken all the supplements, this. And she said, but Norman Deutsch says that it helps people sleep. I was like, it does. And so it was fun to work with this individual because she was just so proactive in things. And so this was our pre-major, of course. And so if you look at the session one, we want a beautiful rainbow here to show the activity, because we're supposed to have more energy, you know, middle brain on out. You know, we don't want a lot of, you know, difference here. But if we look up here, we still have probably a little less activity, because that's where that right temporal lobe injury was. However, it's profoundly prettier than this one. And so for her age group, she should have in the range of 6 or higher of volts. That's that neuroenergy. Again, neuroenergy correlates to that blood flow. And so the first one, we had a 0.2 here. So not very much energy. And look, we don't have a pretty picture here. Yeah. If not, you know, that's a correlation.
Not much going on.
No. And of course, this individual, and I'm so used to this anymore with cognitive stuff, I just kind of sit there and smile when they're like talking really slow and word finding and forgetting things. And because I'm just like, okay, this is going to shift. This is going to change. And yes, this person talks much faster now, is less word finding, and most importantly, can sleep. So this individual then, after the 20 sessions, because she'd been having a friend drive her all the way up here, purchased a polychromatic system device, and that's been amazing for her. And she is like me, it is her crutch now. She does it every night before she goes to bed. So that's this beautiful QEEG brain scan. Thinking about it too, the neuroenergy within our brain correlates to blood flow. We are increasing the blood flow. The longer that someone has been the way they are, again, we start to get the cognitive, noticeable, you know, symptoms with dementia, Alzheimer's, 10 years after it starts to develop. So looking at something like this, if we saw this person here, and honestly, you can sit there and say, like, was it the concussion or was this dementia? I don't know. But
who knows? At 78, it doesn't matter. So just to put this, just to re-clarify, when she first had it tested, before the photobiomodulation, her entire voltage of her brain was 0.2 microvolts. Yes. But when she was finished, it was 6.2 after 20 sessions. That's remarkable.
Yeah, and for the age it is too.
Yeah.
This is common for a teenager. And so I could throw a whole bunch of, but she actually requested that I use her as an example because she was super excited about the whole process.
I don't blame her. That was impressive.
That's why I threw hers in here. You know, it's like, okay, so do I sit here and beg every parent if I can? And I certainly got permission with this case study in here. And then I'm also quoted in here saying how it helped my sleep, because I don't know, I can't say it enough that, man, if we're not sleeping, our immune system's low, we have inflammation, we're just not functioning. That's all there is to it. So sleep is just so important to every single process. You can do all these other things, but if you're not sleeping, and that's one of the things that they have found. You know, they talk about the tau protein, this build-up thing with the CTE. Well, our brain flushes between 10 p.m. and 2 a.m. So that's why it's so important to be asleep at that time. So if you're one of those people tossing and turning till 2 a.m., that was me, 2 a.m. to 7, I'd be like, okay, I got some sleep. I'm happy now. You know, you're not getting your dumping period, so you are getting a buildup of toxins. That's just what we have to dump toxins. We have to tear down and rebuild constantly. Sleeping's our rebuilding time. And one of the measures on that, you know, when you're thinking about if you're not dreaming, you're not going into deep healing sleep. So thinking about that within things like, I love that I dream. I dream every single night now, and it's just pretty cool.
That's wonderful.
My hat. But I kind of like my hat. These are a cool, fun toy. Well, for nerds like me, I suppose, but yeah. And yeah, so, oh, and there was my personal story one again.
Well, it's been a wonderful journey. And you know, the fact that you've come so far, that's just so impressive.
Oh.
I appreciate that you've taken the time to share it with us today. And we've learned a lot. My specialty is not the brain. So thank you so much, Paige. I appreciate all the time you've had to share with us.
I mean, it's been a pleasure to be here. And if people can take anything away from this, it's like you can get better. You don't have to be in this space that you are. And just being a mental health provider, and even just my own personal struggle, I mean, you don't have to endure the pain anymore. So
that's wonderful. Thanks so much, Paige. Sure, everybody's going to enjoy listening to this. Bye-bye.